upper one, I'm inserting it here, and I will be checking first very naturally. I want to see again how retentive this one is. Okay, so when I'm checking retention, I try to, now I have the tip, right? So using my 2 finger, I can hold it like that, clear? And against the vertical direction, I can pull it up, right? So if my wax denture, and if my wax dentures the base plate, the fitting surface, against the palate, achieves, you remember your first year lecture, my lecture, adhesion and cohesion, me, Spurti and Siddharth, right? Achieves the adhesion and cohesion, then I supposed to get a suction, right? Which means that I have created a negative seal inside. So it won't be coming out easily. And believe me, if you have achieved very good retention, what will happen? You'll be wearing gloves, right? Your finger will slip from here. It will be tagged there. It will be very good retention, right? So retention I will check. So number 3, I have checked the retention. Number 2, I want to check stability. How stable the denture is, right? Is it rocking? So it's called 2-finger test. 2-finger test. I can hold exactly at the premolar area, and I try to push like this, exactly like that. If it is stable, this is stable. Do you understand? Right? So this is the preliminary check that I am doing, right? Samson, do I need to check anything at this point? Okay. So as we are okay with the retention and stability, actually right now the points that I am saying to you, believe me, I am not remembering the points that which one is like sequentially one after one, right? Like very simultaneously, importance wise, I am just telling you, because these things should appear to your mind, right? So try not to remember, feel the importance, so this thing will be automatically coming to your mind, asking you to check. Now, number 3, definitely I'll be checking that, okay, I have arranged the teeth, and I want to see that when the patient at the resting positions, how much portion of my teeth are visible. Do you remember we took a strategy during the maxillary rim, that we said that we want our maxillary rim 1 to 2 millimeter show up from the lower. If this is the lip, if this one is the lip, sorry, this lip is injured little bit from this side. Anyway, so this one is the lower border of the lip, right? This is my lower border of the lip. So we kept 1 to 2 millimeter clearance visible, right? So same thing we want to see with the teeth. At the resting position, how much portion of the incisor edge is showing up, right? So I should be able to see at least 1 to 2 millimeter at the resting positions. If I could see 1 to 2 millimeter with the resting position, then I should be also able to see when patient smiles. Right now, let's consider the patient is actually, this is not an ideal phantom head. The lip is damaged, but anyway, let's say the patient is smiling. So if the ideal situation is 1 to 2 millimeter, so with the smiling condition, you should be able to see more portion of the teeth. Am I correct? So I have checked what? Incisor clearance. Cindy, where is the fork plane? Fork plane. So then you remember what we created with our while we are setting up the occlusal plane. We had 2 occlusal plane, right? Anterior plane or anterior posterior plane. So we did the setup of the artificial teeth. Now it's our duty to check with the teeth. My anterior plane is parallel to my interpupillary line or not, right? Similarly, my anterior posterior plane, right? The anterior posterior plane, this part, right? Hold it. Can somebody hold a scale for me? Can you? I'm just explaining it. Okay, give me a ruler or something. Yeah. So I will check this one. Okay. That is it parallel or not? At the same time, I will check. Yeah. Yeah. So at the same time, I'll be holding this ruler, alatragus line, okay, and I will check the anterior posterior plane is parallel or not. So if these four things are okay to me, so I can consider that, okay, these four factors that I fixed with the occlusal ring is also being achieved with the teeth setup. Am I correct? Okay, fine. So then what we can do, we can insert the lower, okay, yeah, this is done. Can you put some glue or something here, or wax or something? So upper is being already checked, fixed, right? Now I'm going to insert the lower ring. Okay. Now upper ring is upper denture is there, lower one I have just inserted. So what I'll be doing, I will ask patient to bite. Now this is the point where you could see that the moment you have asked patient to bite, and now the patient is going to bite with a wax denture. Guys who are sleeping and semi-sleeping, just wake up, because I am just going to tell some very important points now. So the moment that you are asking your patient to bite, patient will give a bite. Here a different kind of scenario may appear. Some patient will give you the exact bite that you are looking for. And that bite was none other than the centric occlusion, which is happening at the centric relation. Understand? Again, the moment you have inserted the lower teeth there, and you will ask, Cindy, can you ask patient to bite? Yeah. I do not know what's going to happen now. Okay. Okay, don't adjust it. Just de-arrange. I mean, put it like a, okay, just I'll keep it like that. Okay, guys, follow. So let's say I have asked the patient, and patient has given the bite. You can see that the bite is not like integrated and homogeneous, right? Patient is in different location. So what could be the interpretation of this one? One is, something is wrong. Patient has not given the bite the way I wanted. I wanted a bite where I wanted to see all the cusps are in contact and proper occlusion, right? But the cusps are actually not in contact, meaning that the mandible is not in the position that it's supposed to be, right? So patient is not biting in the centric occlusion, or this is not the horizontal relationship of the mandible, right? It is not the CR. So at this point, what you can do that, you can intervene, you can interject, you can guide the mandible, okay? You can guide the mandible and you can say that, okay, sir, open your mouth, relax, sip some water, swallow, relax, okay. Can you lift up the tongue, tip of the tongue, and bring the tongue a little bit backside, and you can slowly guide the mandible in a retrograde position and make the contact. Okay, so let's try to do it. Can you help me? So Cindy is helping us to guide that one, right? Because this phantom, this is a mechanical head, is may not be the perfect, just some part you just imagine, something like this. So once the patient got understood your message, then you ask patient to redo. So you will notice that patient can do that, right? Because sometimes with the wax denture, trial denture, patients, because muscle has got a memory called muscle memory, right? Now hold it like that if it is not perfect. Okay, so then you understand that, okay, now patient is achieving the centric relation and centric occlusion. You understand? So then you look for that the bite is across the upper and lower arch from one side to another side is properly touching each other or not. So in a maximum contact or not. So that is actually known as MCP, maximum cuspal position, right? Okay. So all ICP means intercuspal position. ICP may not or may be in the centric occlusion. randomly if you make a contact with any tooth, upper and lower tooth in any position, you can call it ICP, intercuspal position. But if it is in a proper cuspation, highest cuspation and centric occlusion, then that is actually centric relation position, right? The MCP, maximum cuspal position. So all ICP cannot be the MCP, but every MCP is actually a ICP. Do you agree with me? Yeah, okay. So now at this point of time, we have checked the centric relation and centric occlusion. Okay? So then we will go back to, our fact sheet, fact check. Okay? I know it's a long day, some of you cannot follow or somebody is following up, just help each other, right? Go back, study in a group and help your friend to understand who could not follow, okay? And always come back to me, I will try to give you more knowledge so far in my limitations. So again, so now at this point of time, I have checked the centric relation, meaning that somehow I have checked the horizontal relationship. So what left? The vertical relationship, right? So vertical relationship, that what I'm gonna do that, I'm gonna measure again the rest vertical dimension. So I can put a mark on here. Can you draw the mark for me? Just a random mark. So at the tip of the nose and the deepest part of the chin. Yeah, correct. Or maybe here. And we will ask patient to be in a normal position, not biting the occlusion, upper and lower arch, but close the lip, and we will measure it. Okay, we will measure it. So we already have had the data during the procedure of maxillomandibular relationship, and record says that the measurement was, let's say, 75 millimeter. Right. Now with this one, you must check how much is the right. It may be different. No worries. It should not be like every time 75. You just write it down. Maybe it is now 73 millimeter. Then you ask patient to give a bite and you measure it. That is occlusal vertical dimension. If you notice that there is 2 millimeter of gap, and if you have noticed also at the same time in MMR, while you are doing MMR with the occlusal rim, you had ended up with the 2 millimeter of free space there, meaning that it is almost at the same rate. No issue, no problem. Do you understand? So that's how you cross check what? You cross check your vertical relationship with the trial denture. Okay, now at this point of time, few other extra things that you need to follow, right? You can give patient a mirror, okay, and ask patient to see it, because patient also has the aesthetic demand, right? So patient would see, right? You can ask patient to speak, talk, right? Patient would do that, and you can take consent. I mean, you can take opinion and review from the patient. That is the patient liking it or not, right? So patient will give their point of view. In majority case, if you have arranged the thing properly, patient would accept it. Okay. There is something called, at this point of time, the speech test and phonetics. Phonetics means you have to speak with the patient in some word, right? Okay. Like I can give you an example. Let's say Facebook. You say Facebook. So when you are saying Facebook, you see your incisor teeth, the lower border of the lower edge of the incisor teeth, upper one, and the lip is touching. Facebook. So you can ask something F related or starting like Facebook, something like that, right? That to speak on, so that you see the denture retention. When the lower lip touches the palatal surface of the incisor, if too much pressure being exerted, sometimes denture may fall out. So you could see the denture retentive capacity. Okay. You can ask patient to speak something on S sound, like 71, 72, 73, 75. Can you observe one thing? When you say something S, your two incisor comes very close to each other. S, can you say S? So two incisors are very close to each other. So if you have not created sufficient amount of freeway space, what will happen? Both incisors will get touched by each other. Yeah. Okay. So this is S sound. You can ask patient to say something bilabial sound. Baseball, baseball, right. Something B, P, where the two lips are meeting each other. So these bilabial sound, S sound, P sound, are there any sounds, right? You can test on the patient, right? I used to try a lot of sound, like Mississippi. Mississippi, right? It has got S, it has got M, Mississippi, right? So Mississippi is actually with the danger, it's a bit challenging to pronounce it. But at the very first shot, patient could speak on that Mississippi properly. So meaning that fine. I mean the denture is in a good shape. You understand? So there are other words are also there. You can look into the website. There's a list of phonetic tests are there. Any question? So that is regarding the phonetics. So once the phonetics is done, right, then we will ask patient to again bite. And at this point of time, yeah. So at this point of time, we have to check, we have to ask patient that, because we know that patient have achieved the centric occlusion, it has got the maximum cuspation, but we want to see the, you know, the intensity of the bite. We do not want one particular area to be receiving maximum amount of the load compared to other part. We want a evenly distribution of the bite. We want the evenly pressure load of between the bite, between the upper and lower arch, right? So we have something called articulating paper. Is there any articulating paper here? Okay. So you follow that. So okay, let me show the articulating paper here. So this is the articulating paper. So if you see the articulating paper, it's very thin. It's micromillimeter of thickness. So it has got two color, red and dark blue or black, right? So you identify, maybe you can identify, okay, I'm gonna use in this position where my red part will be positioned against the surface of the upper teeth, and lower part will go against the black side, the dark blue or black side. Okay, so I'm gonna put at one side first, and I will ask patient to bite in a centric motion, like at least 1 to 5 times, like this, something like that. Cindy, can you try doing that? Something like that. So the one bite that I'm asking with the patient, this is I'm asking in a centric occlusion manner, right? Okay. So I will do the both side. Same thing. Okay. Fine. You can also do the anterior segment also. Okay, fine. Then what you can do that, you can take another strip like that and you can flip upside down, change the color, right? So now at this point of time, when you have changed the thing, you will not ask patient to do a centric one, you will do the